Good afternoon, everybody, and thank you for taking the time to join us for this 1-hour workshop, which we hope will prove valuable to you. My name is Peter Newton. I am from Within 3, and I'm joined today by three colleagues, actually, one of whom wishes to remain a little bit anonymous today, but I'm joined by my colleague Luke Rogers from our business partnerships team and Nicola Emery from our marketing team. And I myself work in client success, so we implement a lot of the kinds of projects that Med Affairs come to us with at Within 3. And my background is over 20 years in the pharmaceutical industry in a variety of commercial roles. So today we're going to be we're going to have a brief intro to talk to you a little bit about what we think we have learned as an industry and Within 3 over the last sort of 18 months or so, since we've all been forced to adopt different ways of working due to the unfortunate global pandemic. And then we're going to go into breakout rooms where we're going to get the chance to have a look at how we might apply some of those learning into future activity planning for yourselves and your colleagues within Med Affairs. So without further ado, before the pandemic, we really only had two kinds of choices for running something, let's say like an advisory board. We could either do it in vivo, we could do it in live, and hope that we can get everyone from the geographies and the time that they require to all meet in one place at one time in order for us to have a valuable face-to-face discussion. Or back in the day, we might have had teleconferences, which I remember myself were very painful, quite often lots of stuttering and awkward pauses. And we moved on to webcasts, which is great. And now with the advent of having really good camera technology and good Wi-Fi, and I do encourage you all to have your cameras on today, it really does help communication. We turn to doing things virtually maybe, but I'm sure during the pandemic, a lot of us have grown to have Zoom fatigue or Teams fatigue, and really staying on camera and trying to concentrate on an activity for more than a couple of hours can be challenging. And so what we've learned over the last 18 months really is that we now have sort of a mix of tools, and ourselves at Within 3 with our Asynchronous platform have added to that toolkit. And it's really now thinking about these tools enable us to work in smarter ways, to use time more efficiently, to not negate the need for live interaction with our stakeholders, but really to think about continuous engagement throughout the year and inclusivity, not limiting our engagements to people that happen to be free or from the geography that's convenient to travel from, etc., but being able to engage audiences across the globe in different time zones in different ways. And we have a series of tools now at our disposal, things that we've got very much used to. In the past, a lot of you have worked on digital document collaboration tools. I mean, let's think of things like Viva and Zinc. In the old days, they are actually document collaboration tools. You've all used webcasts, we're on one now. We've all done live in-person meetings, emails, telephone, but now we have things like our asynchronous platform and others that are around, which can enable us to have discussions in a reflective and considered way over time and at a convenient pace. What we're seeing is, if we think about the model of a traditional advisory board, so let's break it down and think about what we might have been doing. So usually there was some kind of pre-read or information pack sent to our attendees before the event. We might have contracted them for a couple of hours to distill this information, hopefully so that they arrive for the advisory board fully prepped with all the information, ready to have a discussion with you. Then we might have had, say, 6 live hours. We all know that during the day, conversations go on. We don't always achieve all of the stages of the advisory board. We have a tool, we have people who like to talk, I'm one of them, and other people who don't get the chance to contribute as much. And really, do these sort of live events also think about different kinds of styles of learning and communication, people who like to reflect before they respond. So, the traditional advisory board has been kind of turned on its head over the last 18 months. And what we've seen is what we call hybrid. And hybrid is where you use the mix of tools we have available to us to kind of break up the advisory board into a slightly different format. So what we're seeing typically now within 3 is we might see a short live webcast in order to welcome your attendees, brief them, share some top line information. And then we're seeing a lot of the deep dive understanding and challenging and probing stuff done on platforms like ourselves, because it enables people to think carefully about what the stimulus they're looking at, what their colleagues are saying. It's convenient, they answer in their own time. And actually what we find is contracting someone, say, for instance, for 3 hours on an asynchronous platform, they contribute a lot more than they would have done if they'd have been with you for a day in a live advisory board. But it doesn't replace the need for that face-to-face engagement. And so, live always plays a part, but why not make it more valuable now by having those discussions asynchronously and giving everyone an equal chance to participate and understand each other? Then when you meet live, you can really use that to move your group forward, to actually work on agreements, to work on action planning. And it's actually a much better use of any kind of live engagement time. We also get a lot of feedback from our healthcare professionals that actually find it a learning experience to work in asynchronous platforms, because they get the chance to read and think about what other colleagues have said and thought. So what we're going to do today is have a think about how we might apply that to a range of different engagement types. So we'll be looking through various stages of the business units and clinical R&D, medical affairs, and obviously commercial activities. So we're going to move over to breakout rooms in a moment, and we're all going to pick a scenario, and we're going to have a look at how we might use our hybrid range of tools to most effectively engage our stakeholders in the future. So the 2 breakout rooms are going to be run by myself and by my colleague Luke, and you'll be randomly assigned by Matt. So we look forward to seeing you shortly.
So wanted to go through some of the scenarios that we have now. But before we do, a bit of general kind of discussion. So what are the thoughts about this kind of more hybrid virtual approach? Any thoughts, any opinions as we go around?
Yeah, I could start with a thought or a reflection. We have tried the hybrid, or at least maybe the virtual engagement on advisory boards during, of course, this year, like everyone else has had to, and some good experiences, especially allowing participants from different parts of the world. It creates the huge challenge of the time zone difference, where we're no longer everyone in the same location, people having traveled to it, and that has created some of the extra things to consider, that if you want to have a participant in Europe and another one in New Zealand, the time zone becomes almost impossible to manage without people having to be on the advisory board at 2 at night or 3 in the middle at night. So that's just one of the things we have experienced.
Definitely. Yeah, my colleague Ali's on the call now. She's based in Carolina, and she's been up since 2 in her morning because we had a company-wide call early today. So hang in there, Ali. We'll get you through. Sebastian, any thoughts about the kind of this virtual hybrid approach?
This is clearly something that we're actually investigating right now, looking at your solution, obviously. As we saw, like you just said, actually, having all the people connected together at the same time with their daily job, their daily life, with the balance between work and life not anymore existing, clearly allowing us to have more time per participants. And when I read having you had one speaker above all the others that could take the time of everyone, clearly for me, this is an opportunity to have everyone participating the same amount of time with the same quality, instead of even investing in like 10 people and only have the outcomes of 2 or 3 of them because they take the talk every time. So clearly something, a place where we want to go, actually.
Okay. Is that something you're finding, Archie, as well? Like in terms of certain people won't be dominating the bandwidth of the discussions?
I mean, you find that at every advisory board. I think the biggest challenge with these hybrid advisory boards, and we do them live and we do them hybrid, is the people that are on camera, you don't know how engaged they are.
That are off camera, you mean?
Oh, well, off camera or
off
just on camera, because you can only see what I let you see. I could be sitting here texting, I'd be doing that, which is a lot harder for them to do when they're at a live meeting. So we're doing live advisory boards occasionally now. With this Delta variant becoming an issue, people have opted to a virtual. I don't like it, but it is what it is.
Sure, and live events are definitely coming back. I mean, and I hope they do too. I look forward to meeting people face to face, but it's really just, I guess, a scenario of needs must. Bhaskar, any thoughts about this kind of the hybrid type approach? Any other thoughts or challenges in implementing it?
Very similar thought process over here as well, because especially with the time zone challenges and also having that attention span, especially on the virtual side of things, that is becoming more of a challenge now.
Okay, yeah, definitely attention span. Natasha, turn your mute off. You've got something to share, please.
Yeah, sorry, I just lost my Wi-Fi, so excuse any repetition that might have come in. I think I think there's tons of benefits, but when we talk about hybrid, I think hybrid needs to be defined, what that means. And as we move forward, my definition of hybrid is really having both presence, the live and some form of virtual presence. And how does that work in terms of engagement and collaboration? Because it's not just having a couple of video cameras in a room and you ask people to speak once in a while. There's more to it than that. So I guess this isn't just for advisory boards, but really any kind of hybrid meeting that we're having in the future.
Sure.
And the other thing you run into is a lot of times, if these are true advisory boards with top level KOLs, they tend to be older and they're not as technically savvy. So if you're having problems, you're having to troubleshoot. I mean, that's not derogatory or anything. It's just the fact of life. And a lot of times they're academic based people. They're used to having people around them that can troubleshoot their problems. And so when there's not someone they're doing it at their home, there's no one there to help them troubleshoot, and you're having to do it remotely. It creates challenges that way as well. But on the positive side, boy, it's a lot less travel.
Definitely, yeah, a bit of time to save. Ray, do you have any thoughts on the matter in terms of implementing hybrid? Sorry, Ray, just turn on your mute, please. Off your mute. Yep.
Sorry about that. So no, took some good notes here, and Archie, I can definitely understand some of your, I guess, frustrations or the issues we see with virtual. I think live, having a facilitator that really engages the audience, because if you do have a dominant person or a few, just having somebody who's good at getting the rest of the room engaged is key. I am like Archie also, I think, how engaged is somebody when it's virtual? And you want to just make sure that they're committed their time and resources and effort to the meeting, because I find myself, it's very easy for me to get distracted if I'm not there. So, but again, it's great because people that may not otherwise attend may now do it because you've given them an opportunity to not deal with the travel and the concerns potentially now about travel. So I think it's good. It's got its limitations, and I think it's just something we're stuck with. And how do we get better at this I think is key.
Okay, great. Okay, it's great. So what I'll do now is I'll just share my screen. Hopefully it's my screen. Okay, yeah, great. So I've got the 4 scenarios here, which I'd like to just collectively, let's choose one. So the first one is around attending ASCO. I think we put the link to this in the chat. If not, you can just read it here. So the first one is around a congress, let's say. There's a need to share and exchange insights well at the conference with all invitees daily, even those not in attendance, and a report is required post-congress around insights that your team has generated internally. The second one is around a phase 3 study. So gather these individuals at an airport hotel location for 3 days to hammer out study design. And then you want to go back to your headquarters and report what you've learnt. The third one is around publication planning, okay, around manuscript development, how you're going to get this done, and how you're going to engage, say, key authors over a period of 9 months to actually kind of evolve a manuscript's development. And maybe the fourth one is around MSL team, getting your MSLs to engage with their regional KOLs. So let's say there's a target of 150 KOLs to engage with a launch expected in a year. So how are we going to go through that process of engaging with them? So I just put it to you all. Any of these scenarios jump out? Which one do you think maybe we should prioritize?
One and three sound interesting, but
1 and 3. Any others? Say 3. Throwing it out there. Publication.
1 and 4.
4. Okay.
Yeah, 2 and 4 as well. Yeah, all of them are interesting. Maybe just pick one off.
All right, great. So let's in this case, let's go with 4. Okay, so you have a small MSL team. You're looking at trying to create scientific dialogue, scientific exchange with 150 KOLs with the launch expected. So the kind of the thought exercise we want to quickly go through here is I guess the first step is really about, I mean, what's the big picture? What are we trying to achieve? Obviously, we're trying to create what? I mean, how would you describe your desired intent or your objective for this type of process? What's going to define success, let's say?
Well, so this is a new disease state. So that means there's probably not been much disease state education that has gone on because there's no sales team. They might have supported some CME. So the MSLs are going to be the very tip of the spear.
Yep. Okay.
So I can tell you, we've just gone through this as a company. We launched one of the first products in lupus nephritis. You got to get out there and see people live for a period of time because these need to be in-depth discussions. It's hard to do these during virtual calls. Now, what I will say is the follow-up becomes much easier and it will work virtually, but getting that initial discussion live where you can actually have some quality time, begin to build that rapport is absolutely critical. It really hurt us in some places, in certain areas, because we couldn't get out there because we weren't sure how engaged people were. And so I would say the objective is to get out there first live, if at all possible. And then if you want to continue that dialogue, because you're talking 30 KOLs here, you have a year, you could easily do some of these virtual touch points in between then and the launch.
Okay, great. Anybody else with some thoughts around this? I mean, what kind are we trying to achieve in terms of success as a metric? Is it share of voice? Your version of net promoter score internally, whatever you have. I mean, what are we trying to kind of level up here?
For me, the metric's always time. How much time are you getting? And our team does track this mainly because you can have 5-10 minute meetings and that's not nearly as productive as a 3-hour dinner with a person or a 3-hour meeting. So for me, the metric is always how much time. And my experience has taught me that especially when you're developing a new relationship, you can get 4 to 5 hours with a person over a period of time. That relationship kind of seems to hit a tipping point where it actually becomes something that's productive for the company.
More like a dialogue and a proper scientific exchange.
Yep.
Okay, great. Okay, cool.
Yes, as well, if I can add to this, for me, it's basically you talk about getting insights, right? It really, what is their behavior? What is the attitude? What will drive education? Where do we have gaps, right? And why do they believe we have gaps in the data? I think this is extremely important as well. Mm-hmm. And the controversial discussion, what do you bring back to the headquarter teams in terms of knowledge, new knowledge, etc. And I think in this setting where you don't get that many face-to-face meetings, I think social media research prior to getting out is critical to really understand the profile of the different external stakeholders.
Mm-hmm. Yep. Okay. Yeah, that was going to be basically my next question: is what kind of deliverables? And we always kind of need to begin with the end in mind. So, what is that final deliverable you want to be able to show your other stakeholders internally, to drive decision making and obviously show your value? It's going to be obviously things like insights, evidence gap analysis. What the initial education rollout strategy is going to look like. I guess maybe something around publication and authoring. Any other types of kind of deliverables you think we should be kind of thinking of in advance with the launch coming up?
I don't think it's all about deliverables. It's about gathering insight as well and understanding from these key customers, and then establishing these relationships.
Yeah.
Well, for me, it's also right how do you actually change their thinking, right? I mean, not all medical experts, right? Key medical experts have the same knowledge and not the same, and they have controversial positions. So how do you change it, right? For me, this is actually the outcome measure, the impact measure. Are they going to talk proactively about something, right? Unsolicited. Do they educate others?
I guess just a comment here. So the assignment is, how would you turn each of these engagement into a hybrid meeting? So basically we need to find out, I think, how these MSLs can engage with their KOLs in sort of a hybrid way, right? Is that not the task or the ask?
Yeah, it is. It is, yeah, but I was thinking strategically, what are we trying to achieve? And with that in mind of trying to do that, then we look at what the toolkits we have at our disposal would be. What are the different kind of ways we could engage with those people, your MSLs. You could empower your MSLs to engage with them. So yeah, it's going to be some of the tools where you've got your live where possible, you've got your on-demand video. So in terms of video whenever they want to see it, like a recording from a congress or a keynote. You've got your one-on-one phone interviews, which can be effective, but just a lot of work, a lot of lifting. An asynchronous platform, which obviously allows kind of the overtime discussion and inclusion. Webcasting, which is really important virtually. Bring an element of that kind of face-to-face together. You can do digital document storage and collaboration on documents too. So, I mean, which type of these?
It's going to be a combination of all these things. I mean, it's kind of like a high school janitor. You ever seen a high school janitor has a ring full of keys?
Got all the keys, yeah, exactly.
And I always tell the MSL, there's one key for that door.
Yeah.
And that key may not work for other doors in the school. So you got to figure out which key it is. For some, it's going to be a combination of all these things. For some, it's just going to be one of these. You just got to figure it out. It's very hard for us to give you a one-size-fits-all strategy because KOLs are very different.
Correct. I think it's preference, as you say, it's the preference of the external stakeholder, right? The medical expert. It's the preference, and that's the right mix.
Yeah, I think someone said it rightly. It cannot be one size fits all. And your question itself is quite broad. Just think about 5 MSLs and 150 KOLs. For rare disease, for example, 150 KOLs would be the universe of everybody in the field versus somebody in general medicine, right? So, but just going back to the fact that the primary KPI of an MSL is very external facing, very one-to-one. I think the hybrid aspect of it, how would they utilize some of these tools to maximize those one-to-one with their KOLs basically. So I think that is the most important aspect of it, and that along with, I think, as part of the strategy, they can couple it with multiple other activities that you have shown, including an advisory board, because it's a new area, new pipeline compound, and it's not just about the scientific exchange on what you want to tell to the KOL. There would be a lot of insight about how do they see this product and the disease itself. So I have had some experiences from my past where there are local, regional, national, international differences about the same disease. And yeah, so but yeah, I would be focusing more on the one-to-one in person, or utilizing these channels when it comes to MSLs. One-to-one is the key here, I guess.
Sure, I think one-to-one is always best practice. I mean, that's the most, I think, empowering for your field medical teams, because that's where they're really going to, I think, set themselves apart and do what they do best, is having that proper scientific dialogue, scientific exchange. But in the world we live in, I think that is obviously challenging. But I think that for me is an appropriate kind of, you know, an end point, and kind of like maybe an initial start point, or the follow-up point post a hybrid kind of KOL engagement process. And what I've seen work really well is what we call kind of an advisory board in a box. And we've seen it particularly in the US, for example, and also in Europe. But the medical affairs team, the heads of medical affairs put together, in fact, what is the kind of questions and answers that they want these the KOLs to be answering, so they can hopefully drive the insights. You know, what is it that's going to change behaviors and you know, add value, you know, to the overall product, identify weaknesses going forward. And then from there, they with those kind of central questions, they then roll out a series of localized virtual advisory boards where there's, you know, one MSL with, say, 10 KOLs or even 5 KOLs running an asynchronous engagement. Okay, so that for example, I've just an example of what that could look like, but that looks something like this. You know, where there's a short kickoff webcast, and then you have your one MSL, and maybe even one of the KOLs is also a co-moderator. Now, over a period of, say, 10 days, they're having their, like, actually answering the questions and kind of responding to the tasks that you put to them. And they're doing it whenever it's convenient to them. So you're not losing people who can't participate at that window of time for that day. So you're always having your tier 1 advisors accessible. And then maybe you do another kind of short webcast, again, live engagement. Hey, what have we learned so far? What have we discovered? And then you can talk about what kind of deliverables you want to kind of bake into the session. And this could be something like the consensus document, the evidence generation plan going forward, you know, the engagement strategy or the rollout. You're going to have the initial launch education plan, and then at the end, you know, you would have the session closes. But after this point, you know, you can now take the transcript of a session like this, where you've got all the words, and we see it all the time where MSLs take the transcript for this, and then they go and do a face-to-face visit. And now they've got all of their thoughts in advance. So the MSLs are super prepared because they have, and they can really add that personal touch to it with the transcript of what that person thought about those questions. And then they can have a very deep discussion and go really you know into the depths about what that KOL shared and maybe what the next steps of working together could be. So this is, for example, how I've seen it work. And they did about 5 across the US. So there was, you know, Florida and the South. There was, you know, Northeast, you know, New England, and West Coast, and so on. So this is kind of how I've seen it done. So what it does is it gives the local touch. So it empowers the MSLs locally to do this. And it makes them, also gives them a bit of status as the moderator for the session. You know, it makes them kind of, especially if they're a new MSL, gives them a bit of place amongst as a peer within that group. But what it also does is, again, if the questions are standardized across regions, you can actually aggregate that all back together, centralize it. And what you've got is that now a really powerful data set So yes, you've done the 6 or 7 groups with 5 KOLs, you bring them back together, and now you've got a single data set, same questions, but now 30 KOLs answering that. And that's worked really well for some of our clients. And that's, it's actually really kicked goals. I know a lot of people, and this is what we mean by virtual hybrid. So a combination of live elements and then overtime. Okay, so the overtime is obviously what Within 3 is known for. This is what our Within 3 Connect platform is all about. So everyone thinks that it's all about doing things in webinars, and live engagements. But what happens is when you're doing everything on a webinar, let's say, again, you've got 10 advisors and the session goes for 3 hours. So you're paying 30 hours of honoraria, but the webinar itself is still 3 hours. So what you're doing is you're putting in 30, but you're only taking out 3. Now it could be a good 3, maybe it's worth 9 hours of output, let's say. But what that still means is that just the inherent nature of that platform means you've just not captured a lot of insights. You're kind of disregarding a lot of their inputs, and you're wasting a lot of honoraria. Okay, you're just not being careful with their time as stakeholders. So that's what a kind of Zoom or Teams platform does when you're trying to receive a lot of insights from a group of stakeholders at the same time. Okay, so this is what we're talking about now, the dominant advisors and so on. Okay, but what an overtime platform does is it gives everybody full bandwidth. Okay, and all of that is put into transcript, deliverables, visualized data, and that becomes much richer. And typically we get 3 to 4 times more transcripts that everybody contributes in the platform. So what it actually does is it turns this as a Zoom call. This is a representation of a Zoom call. Everyone in the same room. It's great to get to know one another, but it's hard to really express yourself. And this is more like an asynchronous platform where everyone's got space to kind of express themselves. Okay, so yeah, that was my thoughts. I mean, any thoughts about that? I think we're about to end in very shortly, but I'm happy to discuss that. Oh, we are
has potential.
Yeah. I think. Sorry, go ahead, Archie.
No, go ahead.
No, what I was saying, I think it's the familiarity is the key. Just take this platform, for example. We gather together as a bunch of unfamiliar people from different.
Oops.
So thank you, everybody. I hope, although 25 minutes goes quite quickly, I hope there were some at least useful thoughts shared in the breakout rooms. Luke, which scenario did your breakout room choose?
So we were looking at the scenario 4 around the MSL for rare disease. Did you have the same?
Yeah.
Fantastic. Okay, great.
It's incredible. In the US workshop, everyone chose scenario 1 in both groups. Okay. In this one, it was both scenario 4. Interesting. Go for it, Luke. Tell us some of the thoughts that came back.
So the one thing that came back is when we showed the in terms of the challenges of implementing virtual hybrid is things like attention span, time zones, and that not one. When I showed the toolbox slide, that not only one approach works for all KOLs, and you do need to use a variety of tools, and not the one size fits all approach won't work. And that's why you do need a toolbox with different tools, which will allow you different ways to approach certain KOLs, which have that preference, and it's all about their personal preference. So that we covered that. That's fine. Then I basically shared the example of the meeting in a box where. One approach I've seen clients use is where MSLs in small regions run a standardized kind of advisory board using an overtime and hybrid model where they get the benefit of live interaction, but then also, again, standardized questions that they can ask KOLs in a very small group, 5 or 10 KOLs. So they still have a local touch and local feel, and the MSLs are kind of a given status amongst that group. But then all of the data can be aggregated back together and can be really powerful going forward. And then I was just talking a bit more afterwards about why asynchronous in terms of, webinars kind of force everybody into a funnel. You're putting time in, but the time of the webinar is a bottleneck in itself. And an asynchronous platform, again, whilst it doesn't have on its own, the live face-to-face interaction, does allow full bandwidth and full kind of contributions from all the advisors, and allows them all to be heard. And we're just about to have kind of discussion kind of after that about what people think and how this could work in their practice.
Okay, that's great. And since we're both on the same scenario, we'll probably end up being able to have a bit of that discussion in the room now. Similar from our group, and please, anyone from my group, do chime in if you want to, but we had a variety of experiences in the room. So there were a few people who had used tools such as our asynchronous platform or other asynchronous platforms. And what we kind of discussed is, when thinking about looking at the types of activities that MSLs might be doing in preparation for a launch of a pipeline compound, they would obviously perhaps be involved in advisory board activities, visits if they were allowed face-to-face. There's nothing wrong with, having that one-on-one time with a KOL. But one of the topics that kind of dominated towards the end was actually congresses, and how important congresses are, and how that's changed so much in the post-pandemic world, in that, whereas everyone wanted to go to a congress in the past, and we might have tried to invite a cohort of healthcare professionals to meet us to talk about the symposia data, as after it was unveiled, as it were, how challenging that is now in a kind of mixed hybrid environment where people aren't accessing that information at the same time, and people are obviously remote, etc. So the tools, again, the use of asynchronous platforms in order to perhaps host scientific exchange discussions is something that's new as an activity that wasn't really able to be utilized before. But equally, we've had some feedback that people have been able to run great engagements during the pandemic in a live format, in a webcast format, and absolutely that can work perfectly. So yeah, I mean, those were some of the thoughts. What other kind of benefits did you come up with in your group, Luke?
We didn't really get to that place. We're just more, it's going to be talking about the feasibility and kind of discussion at that point on. So basically, we want to kind of continue that if we can. So I think Archie and Pranab, Pranab, did you want to share what you were thinking?
Yeah, I was sharing about something, and then it transmitted me to this window.
Yeah.
So what I was saying is that it's all about familiarity, and I was giving the example of this cohort of people, and here if you look at the body language behavior, we are also kind of senior people in the industry, and we have been very polite to each other, very formal to each other, waiting for everybody to take their turns. And that, I think, is a big gap that we cannot address through virtual unless and until we are able to make people know each other, become familiar with each other, which you get to see in an advisory board face to face, when they know each other very quickly, and then that magic happens where good ideas, good insights generate very automatically, not in a very formal way. So my focus, and what I tell my teams, is that see for the moment where you actually utilize the pre-meeting time, where you basically send the pre-reads out, how to connect these advisory board members to each other through some tasks. So it is usually pre-work rather than pre-read in the advisory boards that I run. That I found to be very useful, because that breaks the ice, and on the day of the virtual meeting, you really see people are almost as connected or mentally, and coming up with some really bright ideas and insights, which is not as good as face-to-face, but very close to it.
Mm-hmm. And Pranab, in the future, do you see yourself using that same method, but with face-to-face?
Yeah, I think face-to-face, you always have that opportunity, because people would arrive a little ahead of time. They would know each other through direct or indirect contacts, and then they get into informal conversation, and that gets the spark going, basically, which is a challenge when it comes to virtual, where you get to see somebody for the first time, and you would always be very reserved about putting across your point of view in a very open way initially. After a few rounds, I think people become quite normal again, but it takes a while.
Yeah, I mean, we would absolutely say that, you know, forming that group mentality is such a key part of a successful outcome to any of these kinds of activities. And I was just
thinking a good moderator, I think, is huge for that. So if you've got a moderator who's going to really set the tone in terms of creating familiarity and kind of breaking the ice and maybe taking the formality down, I'm not sure too, while still being productive, I think that we've seen that works really well. Having a great proactive communicative moderator, I think, adds a lot of value to the overall discussion.
Yeah, I agree with that as well. I've seen live with some of my experience. Sorry, my camera has been a bit faulty today, so my video must have gone off for some reason.
No problem, no problem. Anyone else? So after, you know, we've kind of been on thinking about this subject now for the last 45 minutes. Anyone else kind of had some thoughts now that they want to share and thinking about either their experience or what they might be thinking about doing slightly differently now moving forward, or want to explore or learn more about?
I think I would like to learn more about, you know, if you're using these digital platforms, how do you consolidate the insights? Because some people are, if there's a live part, they're speaking orally, some people are typing Post-it notes, and then people are doing stuff offline. And, you know, up until now, we just have like an agency or someone coming and pulling it all together. But is there tools or ways to simplify the insights analysis?
Yeah, so on that, I can speak to that. So our platform basically harmonizes everything into a single transcript. So all of the multiple choice questions get turned into visualized data, into graphs. So you can say, oh, we can see that 80% of people want this, 20% of people say no, and why. So platforms like this create a single harmonized transcript, which can be segmented by topic or by individual advisor. So your MSLs can leverage that when they go and approach advisors. And then from that one product we're just rolling out right now is effectively a very short insights summary, like an executive summary, which is automatically generated after every session. So people who run sessions on Within3 get the full transcripts, like every single word that is entered. So you always have that as your kind of source document. But we're now doing effectively kind of free executive summaries that are top line notes, kind of 3 to 5 slides, think of it, that are designed to be actionable recommendations. And all of this is about that. It's about speeding up and accelerating your timelines to make your life a bit easier, because our platform, as you know, generates massive volumes of transcript. And I've had some of my clients actually kind of, that becomes almost a bit of a problem where they're like, well, I've got 60 pages here, like to work through. I never have time to read 60 pages of transcript. So this is about accelerating that process, and that's what we've done.
And one of the advantages as well, and another segue into something we'll be going on to more next year with our virtual engagement offering, is I don't know how many of you know, you're aware within your organization that ad boards get repeated in different geographies and people don't necessarily talk to each other, and there isn't the connection made between some of those insights within organizations. So one of the things that we're looking to do moving forward next year as part of the mix is we will be being able to provide you with, a dashboard of being able to match insights from a variety of activities that you've done from different geographies, different meeting owners, with your even with your key opinion leaders and participants as well, looking at what their insights are across a range of activities rather than just in a singular activity. So the digital space definitely offers some advantages, certainly when it comes to analyzing and cross-referencing, those kind of valuable inputs you get from your healthcare professionals.
Yeah, so no more German team approaching one KOL and then global medical affairs team approaching the same KOL for a similar insight session.
I can see how your tool can work perfectly in that setting. I'm very interested to hear what was the outcome from the scenario one that you did in the US, because I think that's a more realistic setting, is that you're entering a congress with these hybrid situations. So could you enlighten us a little bit there?
Yeah, so actually we talked a little bit about this in our breakout, but absolutely. So what we're seeing is a very common use case across our platform now, something called a Congress Huddle, which is effectively a scientific exchange. So I'll give you a typical scenario. What happens is you may have sort of your tier one KOLs, which everyone wants a piece of and everyone wants to hear from, especially their reactions to certain key data as symposia as they unfold. And then you've probably got a whole range of healthcare professionals that you want to kind of engage with and also understand everyday opinion and how it's going to affect their practice, etc. What we're seeing is companies are utilizing the platform to allow their tier one KOLs to host asynchronous discussion groups that span the timeline of the Congress, but the benefit versus having web conferences or having a live chat function within the Congress is that people are consuming data at different times and different time zones. So it allows them to then come in and join a conversation with a top KOL in their therapy area about what they've just seen and see the thoughts and understandings of other healthcare professionals on a global reach, something which you probably wouldn't be able to do in a live environment. Does that kind of give you a flavor of that scenario?
Absolutely. I'm curious as to how that works across the different time zones. So is it like a chat where you go in and read, and if you're sitting in Australia, you read it later? And okay.
Yeah, it's a discussion forum. It's a bit, I mean, in its very simplest form, it is a highly compliant discussion platform that just has a range of other tools that you can collaborate on, documents and various other things that you can do. But the essence is about over time discussion. So you will see, you log in, you see what comments and discussions have happened in the previous timeline. You can add to that, you can join in a discussion wherever you want to. So it is just about elongating that engagement with these people away from just these snapshot moments to actually being able to have a more reflective and valuable exchange over a period of time.
I have the demo to show, Peter, if you want me to bring it up.
No, I mean, obviously, I mean, as participants in this workshop, we would love to follow up with some of you afterwards, of course. So we will definitely, you know, but please don't think of asynchronous platforms or any of these tools are just for advisory boards. There are a whole range of ways in which they can be utilized to have a great adjunct effect. Going back to Pranab's point about really valuable face-to-face time. Yeah, we might be able to form really good relationships and group thinking in quicker in face-to-face, but over a period of a year, there are so many different ways we can keep engaging with our healthcare professionals in a valuable way. Any other thoughts?
Archie, what were you about to contribute with the end of my little kind of discussion before? You had just some thoughts about in terms of concerns about how to actually apply it.
Well, virtual is nice and we've used it quite a bit and out of necessity. I think, you know, from a personal point of view, one of our challenges, we have a condition where the patients are co-managed across two specialties. That creates a little bit of a problem. We want them both in the same room talking because we learned a great deal from them and they learn a great deal from each other. So particularly out in the community setting.
Okay. Yeah, I mean, we have, for examples where we have sessions with, you know, one group of radiologists and one group of oncologists kind of together in the same space. So I think scenarios like this we can do, you know, we can have them in a single room or we can break them out by specialty. So yeah, there's lots of ways to do it. And I agree, having a cross-pollination is really important. And that, I think a lot of times things like that actually drive insights coming out of the discussions.
Mm.
And you brought up a key word there, patients. We're always trying to put the patient at the center of everything we do. That's always been, you know, the mission for a long time. And actually what we also have seen is there's a big benefit in using these kinds of engagement platforms to engage with patients, because it gives them the comfort of being a little bit separated from you, being able to think and react in their own time to the stimuli that you want them to. They get to hear from other patients, which is something that they really value, because then they, you know, rather than going on unmanaged forums and hearing all kinds of crazy theories and things like that. They're hearing from patients in a structured environment and learning about experiences from each other. So again, it allows participation that might have been tricky before, or may have put patients under pressure, or they may not be able to attend certain activities, etc. So, you know, these kinds of tools can really drive real good value there.
And it's all anonymized too, so we blind the patients, so their names aren't revealed. They could just be patient 1, patient 2, or we've given them Game of Thrones aliases and pictures and things like this, so we can muck around and make it enjoyable for them. So engaging patients payers is no problems. Sorry, is there a question? No. Bhaskar, any thoughts? Any questions?
No, I think the discussion has been quite helpful, and it was good to know that there is a lot of echo about some of the ideas that are being reviewed internally as well. No, the workshop was really helpful.
Okay, great.
Thank you very much for organizing this.
That's okay. As I said, we'll be keen to follow up with you afterwards. And for those of you who are interested in learning more about what we have to offer, we have a lot to offer more than our virtual engagement platform now moving forward, as Luke and I have alluded to. So we're very excited about this space.
Yeah, and the next week we'll be launching two very interesting products. So those who are already clients of Within3, we'll be reaching out to you, don't worry. And those who aren't yet, we'll be glad to speak to you and try and make sure that what we have is going to fit your needs and be appropriate for your applications.